Hey, hello, guys. Good evening, and welcome to another edition of Real Health Talk. I trust you've all had a good day. And this evening, I'm going to have a special conversation with a doctor that is no stranger to our screens. A couple of years ago, we had him on, and it was about the same issues or on the same story, but we took it from a different angle. And this evening, we're live again to talk about the same problem, but from a different angle. Now, we all know that in October, we celebrate breast cancer awareness, or we bring about the awareness of breast cancer. For some people, breast cancer could be new to them. For some of us, it could be the same old tale, the same old devastation that is bringing to people. We know that, well, I don't know the other stats in other countries, but in the UK, from what I read recently, and I think it's quite shocking, is that 1 out of 7 women are diagnosed with breast cancer every day. And I think that is quite shocking. That is quite a large figure if you kind of think about it. The 1 in every 7 women are diagnosed with breast cancer daily. And so this evening, I have Dr. Kelvin Owusu. He's no stranger to our screens, and we're going to be talking about breast cancer. We're going to talk about the word that is quite it's a big word to a lot of people. It's brought about a lot of devastation to some families. It's still causing havoc in some women and even in some men as well. So if you've just joined us this evening, we're talking all about breast cancer, the causes, the treatment, intervention, aftercare, beyond, and all that. And for me personally, I heard a new word with breast cancer, and that is called the secondary breast cancer. And to me, I had never heard it before. All I know is that breast cancer is breast cancer. I didn't even know we had the secondary as well until when I was trying to put all these information together. And if you know me very well, you know that before I come on your screens, I go and I read about the topic that we're going to discuss. I am no professional, I'm no medical professional. And so I get a medical professional who would come on and explain things to us. So, if you've just joined us, please share this link to your friends. If you're watching us live on Facebook or on YouTube, invite your friends. Listen, I want every woman to gather family and friends, girlfriends, even boyfriends, husbands. Just gather around. Let's gain information. Knowledge is power. Information is vital to our daily lives. And so, good evening, Dr. K. That's how I call him. I don't call him Dr. Kelvin. Dr. Kelvin sounds a bit too formal. But hey, Dr. K sounds a bit more. I want to hype the swag.
Good evening.
Thank
Good evening. How are you doing, Sandra?
I'm very, very well, thank you. I'm very well, thank you. How has your day been?
Awesome. Awesome. Well, I mean, it's October, so it's been packed. I've been doing quite a bit of a campaign on breast cancer, so you can imagine. But
Wow.
yeah, it's for a wedding, so it's all good.
Absolutely, absolutely. Now we're on again with the same issue, breast cancer. And I know October has been about raising awareness on breast cancer. So the last time we were on, we talked about the awareness, we talked about what causes it. And this evening, we're going to talk about the same thing again, and then we'll take it a bit further. Do
All
we
right,
have a
that's fine.
specific cause of breast cancer?
Unfortunately, no, we don't have a specific cause of breast cancer. As with a lot of the cancers out there, we really don't know what the definitive cause is.
Mm,
What we can tell though is the associations, the things that make one more likely to develop breast cancer in this discussion. So even though we don't know what causes it, we know the kind of things that we can do that puts us at risk of developing it, or that can
mm.
help us prevent it or avoid getting it. So that's what we do know.
Okay. So, what are some of the things that we think we know that can cause breast cancer? And I know there's quite a lot of myth about breast cancer. Some people say if you put on
Yes,
tight bras, you can get breast cancer, and there's a whole lot of myth about it. But let's talk about myth. Let's take it from the medical side. What do we think are
all
some
right.
of the
So
causes?
Okay, so the risk factors for developing breast cancer, we group them generally into two. We
Mm,
have the modifiable and the non-modifiable. Modifiable refers to ones that you can actually do something about, and then the non-modifiable is the opposite. You cannot do anything about it. And the primary non-modifiable risk factor is age. Cancer in general, I mean, as you grow older, your risk of developing it also increases. So
mm,
the older you are, the higher the probability of you developing cancer. And it makes sense because the cells are getting older and older. So I mean, the risk that they may go haywire, it's quite evident over there.
mm,
In fact, beyond the age of 40, the risk of developing breast cancer for a woman almost begins to double every decade. So it's really, really significant. Yeah.
wow.
And then yes, yes. And then which brings us to the second risk factor, which is the fact that you're a woman. There are things that a woman has that a man doesn't have that makes the woman more at risk of developing breast cancer. The number
Mm.
one thing would be the breast itself. I mean, men, look at me. I don't have anything to show for myself. So I mean, it's kind of obvious why men don't get breast cancer as often as women. It doesn't mean they don't get it; they still get it, but they don't get it as much as women do. So the
Mm,
fact that you're a woman puts you at risk of developing breast cancer. That's one. Then the second thing is the hormone estrogen, which is
mm-hmm,
very high in women, also predisposes you to developing breast cancer. In fact, estrogen is what is the key player in this breast cancer discussion. Because I mean, you bear me witness that in the course of your menstrual cycle or your monthly cycle, you realize that your breast becomes a bit heavier at some point, and then it
mm,
goes back to its normal after at a certain point. So this increase in size, reduction, increase in size, this cyclical changes in the size of the breast, can make the cells kind of go, they become complacent. Think about raising your child. If you're always beating the child, it gets to a point the child will not respond to the caning anymore.
yeah.
And so if the yes, so because the breast cells are constantly being stimulated by this estrogen, it gets to a point they might kind of go haywire and stop responding. And at
Mm,
that point, they are said to have become cancerous because they begin to divide uncontrollably, and then they begin to break off and implant elsewhere, and begin to cause havoc in the new site as well. So those are the two things that being a woman makes you predisposed to breast cancer. You know, then and sorry, and before I move on, so in relation to the hormone estrogen, some of the ways that we're able to determine, or some of the ways that gives us an idea of who is more at risk, are the age at which you had your very first period. So if you had your very first period before the age of 10, your risk is a bit higher because it's assumed that your exposure to estrogen is going to be more than the average woman. You know,
mm,
and if you had your last period, if you are postmenopausal, but then you had your last period beyond the age of 50, again, your risk is higher because it's assumed that your exposure to estrogen is also high. So if the same woman had her first period before 10 and her last period after 50, that means that your risk is significantly high because of the continuous exposure to estrogen. In this regard, pregnancy has also been noted to be protective against breast cancer. So the more times you are pregnant, the lower your risk of developing breast cancer because pregnancy tends to reduces estrogen to the barest minimum for the duration of pregnancy. So when you carry a pregnancy to term, you've got at least 10 months of low estrogen, which is protective. And if you go further to breastfeed your baby, then your risk is further reduced because that's an additional 2 months, or even for some women they can go up to 6 months, with little without menstruating, and so that's quite protective. I don't know if you can still hear me.
yeah.
And so great, great. So that's the protection that you get from pregnancy. Of course, it does not mean that you should go and born plenty because pregnancy is because because there's a secondary risk of what do you call it, cervical cancer with every pregnancy. So you kind of have to decide how you want to go. Do you want to go with the breast cancer, or you want to go with the cervical cancer? Then you decide how you want to play it. So that's
Wow.
the right there. Of course, there are other risk factors
Wow.
as well. Family history, for instance. Family history is
Yeah.
very important. You can't do anything. If your mother had breast cancer, your risk is higher. If your
Mm-hmm.
sister had breast cancer, your risk is higher. If your father had breast cancer, your risk is even higher because I mentioned earlier that the men don't have much breast tissue. So
Yeah.
if in the small breast tissue they have, they still manage to develop breast cancer, then it means that the gene that predisposes the family to develop breast cancer is strongly represented in your family. So you want to take care of your breast even more. If a male first degree relative develops breast cancer, it's a big deal. you know
Wow.
then there's personal history. Again, if you yourself have had breast cancer before, your risk of developing it is also high in the same
Mm.
breast and also in the opposite breast as well. So you don't want to slack on your screening at all. So those are the non-modified. You can't do anything about those things. You can't do anything about your age. You can't do anything about your gender. You can't do anything about your family history or your personal history. It's happened already. You can't change it. But there's the modifiable, and this is predominantly linked to your lifestyle. So are you living a generally healthy lifestyle? Because if you're not exercising, if you're overweight or obese, if your diet is high in fats and processed foods, then you're putting yourself at risk of developing breast cancer. If you drink alcohol as a woman, especially, women who drink alcohol, the heavy alcohol drinkers are at risk of breast cancer. Smoking, women who smoke are also at risk of breast cancer. But these are things that you can change. You can make a decision to become more physically active. You can make a
Mm.
decision to reduce your weight. You can make a decision to stop drinking alcohol. You can make a decision to stop smoking. So these are the modifiable risk factors. You can do something about it to reduce your risk. Very important.
Sorry, I think I got lost there for a minute, but I'm back on now. Um, wow, this is quite intense. I mean, listening to you, I'm just like, wow, there is quite a lot to learn. Even lifestyle change, and so I'm thinking that before you even hit the age of 40, you should actually now think about your life, because if you're not eating properly, if you're not taking care of your health, if you're going out partying and drinking and smoking, you're putting yourself under risk as well. But hey, well, I can't really say anything much. But I don't think that a glass of wine here and there is actually that bad as
No, no, it's not that bad. It's usually the heavy drinkers. A glass of wine is okay. It's not. It's not. It's,
yeah,
it's not. We don't want you to not enjoy life at all. You need to enjoy life, but moderation is the key.
it is the key. Absolutely, it is. So if we're talking about the hormones as well, we're talking about breastfeeding, we're talking about
Yes.
pregnancies. All
Hmm.
these are stuff that women go through.
Yes.
So for me, with all my three kids, my firstborn was exclusive breastfeeding for the first 4 months. It was exclusive. With the other two, it was mixed feeding because I just couldn't keep up with the breastfeeding. So, but I breastfed all of them for 1 year. I mean, so
Yeah.
I think I can say well done to myself. But with it,
Definitely.
yeah, on your first birthday, I say bye bye to you. Uh, okay. So now with the hormone estrogen,
Hmm.
that is what causes or cause help brings about some of these issues. At the same time, if we don't have them in our system as well, there's another problem with that, isn't it?
Well, estrogen is the hormone that makes you a woman. And so without estrogen, it will be difficult to stay a woman. You see.
Yeah, but then
Yeah.
it's also some of the causes of breast cancer as well.
Yes.
So
Yes.
what do we do? How do we balance it?
You see, so that's why it's categorized under the non-modifiable. You really can't do anything about it. And so to try and balance it would mean you counteract it by taking your screenings more seriously. You see,
Mm,
but let me actually chip this in before I forget. You
mm,
notice that as the years have gone by, our girls are getting their periods earlier and earlier. So
true.
now you actually find that most girls are having their period by the age of 10. Most girls have actually had their first period.
Yeah.
So this should actually begin to draw your mind to the discussion we're actually having right now. Because what that means is that most of our girls are going to actually are going to be exposed to estrogen for much longer than maybe probably you did.
Yeah.
Because our mothers and grandmothers were having their periods by 12, 13, 15. Some people are having their periods even at 18, especially if you check
Yeah.
our grandmother's generation. And so if our girls are having their periods so early, it could mean that the age of breast cancer is going to actually come down as the years go by. And
Yeah.
so this is why this education is really really important, because we need to begin to make our girls aware of this so that they can begin their screenings. You see, because again, this whole month, as I started by saying, this whole month we've been doing breast cancer awareness screening campaigns. And what you realize is that the older women actually come in for the screening, but the younger women don't because they feel I'm too young to get breast cancer. But
Mm,
I personally have attended to an 18-year-old who had breast cancer, you know, and it was actually bilateral, so you are not too young to actually get breast cancer because the factors are there. We are eating more processed foods nowadays.
mm-hmm,
Childhood obesity is real. Our children are overweight nowadays, so that by the time that child becomes an adult, he or she is actually going through things that adults were experiencing in previous years. And so
mm,
the risk of developing cancer might actually come lower as time goes. And in Ghana, let me just chip this in Ghana for you to realize how real it is. In Ghana, we are diagnosing about 3,000 breast cancer cases every year, right? And these are those that come through the hospital. There are those who don't come to hospital at all, so we don't even know the numbers we are missing. Now, 35% of these 3,000 are women under the age of 35. So that should tell you that should give you
wow.
information as to what I'm telling you, that in the near future we are going to have the age of breast cancer actually come down, gradually. So we really need to take the education and the screening more seriously than ever.
Yeah, yeah, that is so true. I mean, when you look at young girls of these days, I mean, come on, they're like 10 years, 9 years. I think when my daughter was like in year 4, year 5, it's like 8 years. One of the girls in her class has actually started her period at the age of 8. And I thought,
Mhm.
wow, this is quite quite shocking because in my days you had to be like 13, 14 before you, and
Exactly.
even that you think you've had it too early because sometimes your parents are like, you're only 13 and you've got your first period, but I think that well, times are changing, and so education is key. Information, I keep saying that information is power. When you have information, you get knowledge, and knowledge, man, nobody can take that away from you if you know what you are about, and
True.
so in as much as we're not just making noise, we're getting people the information they need to go out there and grab hold of what they think is necessary for them. Now, a lot of women don't even go for screening
Mm-hmm.
because I know that after the age of 40, you can go for screening, or even before the age of 40, you can still go for screening. But a lot of women still do. It's just like going for cervical smear. A lot of women still do not go. How can we get women to understand that going for this screening is not just because the whoever is doing your screening wants to touch your boobs or see the shape of your boobs, and actually want to give you help? So when they come to you, how do you encourage them to go for screening?
I mean, it's one of those things that, I mean, as you said, I mean, it's always an interesting thing because people want to, I guess, protect their privacy, But we need to understand that ultimately, if you do get breast cancer or any illness for that matter, that privacy you're protecting will literally will become
Public property.
exactly. So better to have it examined when you are in control than to
Yes.
wait for something to happen and then be at the mercy of whoever it is. Because really at the point when there's breast cancer, it like you are limited in the choice of specialists because if there's only one specialist in that area, you have to go there except you have money to go to a different place or something. So we need to do what we need to do now, and get
Mm,
the screen done. And the good thing is that in October, as particularly in Ghana, I don't know what's happening out there. There are so
yeah.
many health facilities that are doing free
Free
programs.
screening. Yeah.
Exactly. Corporates are doing it, churches are doing it, so it's really inexcusable to not get screened. If
Absolutely.
you don't want to have a male screening you, there are females also doing it, So if you go to this place and it's a male, well, it's free. Just move on to the next place and get a female to examine you. You see, but do not go through this month of October and not get screened. You see,
Yeah.
because if I mean that screening, case in point, I mean, like I keep saying, this month, this is real. This month we screened almost what 500 women, and I mean, thankfully we haven't seen significant numbers of issues, but we've got about 10 people who had suspicious things in their breast, you know, just from the physical examination. So now you have to move them on to do the other investigation, the imaging, to see if there is indeed something happening. About 5 of them have come back with results, and it's not cancer. I mean, whatever is going on, it still needs to be attended to, but it's not cancer, which is good news.
Yeah.
We are still waiting on the others to bring in their results so that if everything is well or not. I mean, who knows if any of these women, and I must say that none of these 10 women actually had any idea that there was anything going on with their breast. Like they didn't know, So
Right.
it was as a result of the examination that we picked some of these things. And so if you think that you know yourself, and so I'm not going to get screened, you might be left with the short end of the stick. So you really need to take advantage of these screenings and get screened, so
Hmm.
that if there's a problem, it's detected early. And I keep giving this scenario. When we say screening, we don't screen when you are ill. We screen when you are well. That's why,
Absolutely.
yes,
Hmm.
that's why it's called screening. So you think you are well, you don't have any symptoms, everything is fine with you. That is the best time to go and get screened, because
Hmm.
cancer does not have symptoms. Let me
Hmm.
repeat. Cancer does not have symptoms. When cancer begins to give you symptoms, it means it has spread somewhere.
Hmm.
Yes,
I
it may
like
have.
that. Cancer
Yes,
does not give symptoms. Does not
exactly,
have symptoms. When it gives you symptoms, it means it's actually spread to other parts of the
exactly.
body.
It has spread.
Wow.
It may have spread in the local area, or it may have spread to a distant area. But once it begins to give you symptoms, it has spread somewhere. I mean,
Hmm.
let's say breast cancer. Typically, the breast tissue itself does not have feelings in quotes. So all the feelings that you have been getting when they are doing, it's actually from the skin. It's from the skin and the nipple area, not from the breast tissue itself. You see, so
Hmm.
if you have breast cancer, it will not give you any symptoms. If you start noticing pain, it means that it has probably spread to involve the skin area. That is why you're experiencing pain. Or it may have spread down into the muscle. That's why you're feeling pain. Muscle has pain. What's it called?
Hmm.
Muscle has feeling. That's why when you go to the gym, you have pain, because the muscle has feeling. The nerves in the muscle, respond. So if,
Hmm.
if the cancer spreads into the muscle, that's when you begin to feel pain. So once you start noticing symptoms, it means the cancer has spread somewhere. It might, like I said earlier, it might be a local spread, but it's still
Hmm.
a spread nonetheless. So we want to catch it. We want to catch it at the point where it hasn't given any symptom, because that is
Hmm.
usually when it's early. That's most likely stage one or stage two, and then in which case the treatment of that early cancer is not as radical as
Hmm.
when it has reached stage three, stage four, where we are going to have to cut off the breast. Sometimes even you remove the muscle and then remove some portions of your your armpit. You know, the later the stage, the more extensive the surgery. We don't want that. You know,
Absolutely. Yeah.
even though unfortunately in Ghana about 70% of patients report late. So it has created a vicious cycle, right? Because they come in late, and then the solution is to cut off the breast. And because you cut off the breast, there's an assumption that every breast cancer is treated with mastectomy.
Masseter.
And so
Hmm.
people who get breast cancer don't want to come back to the hospital because they are afraid that their breast will be cut off. So that's the vicious cycle
Yeah.
that we are dealing with, all because people
Hmm.
come in late. We want them to come in early, so that the
Yeah.
intervention might not necessarily mean cutting off the breast, in which case that perception will begin to change. It's a very important point.
It is. It is. Now, there's quite a lot of myth as well going on about breast cancer when it comes, especially in October when we do the breast cancer awareness month, where you see people go braless day, showing your tits in your t-shirt, and having your man squeeze your boobs, or sucking your boobs just so that you don't get breast cancer. And I think this is all a myth that people need to actually understand that it's not about it's not about your man sucking your boobs. That is what is going to prevent you from actually getting breast cancer. But so I think there's a bit more education needs to be done on that. I call it a myth because I don't think it's true for you to just go a whole day without bra because you think it's called, I don't know, forgotten the name they use, and you
No,
see
brother.
no bra day or show your tits day and stuff like that, and you see women on social media, I mean, literally exposing their stuff because they think that this is what is going to prevent them from getting breast cancer. Now, now let's go into someone that has got breast cancer or being diagnosed with breast cancer. Even before that, how would someone know that they're developing breast cancer? I know that we say, oh, when you feel a lump in your breast, go get assessed and all that. Now, a couple of years ago, I think the last time I shared with you as well, a couple of years ago, I was having a bit of a pain in my left breast, and I went to see my GP, and she said I was lacking vitamin D. That is what was causing the pain, and so I started taking, because there's not a lot of sunlight here, so I was taking
Yeah.
vitamin D. supplements. And well, when I started taking vitamin D, the pain stopped. I did all the tests, came clear. So how would someone, because I was thinking at the back of my mind, what is going on? Because there's no lump in my breast. I can feel it. There's no lumps, but then there's pain on the side of it. Now, how would someone who is feeling these symptoms or getting these pain think that, oh, I think I've got breast cancer? Or how would they know that it's not breast cancer? Unless they come to see you, isn't it?
Yeah. Well, I mean, so just to repeat what I had said earlier, we don't want you to even know you have cancer before you come and see us. So that's the first thing. So we want you to, be doing your self-examination and then have at least an annual physical examination with your medic or your GP or your doctor, so that we know that everything is fine. And once you cross the age of 40, it is mandatory to have a
Mm-hmm.
mammogram done every 2 to 3 years, depending on what the protocol is in your jurisdiction. So that
Yeah.
so that's what we want you to do. We want you to come in and have all these assessments done, so that if there's the slightest chance of cancer, it is detected before it's even established. So we don't want you to wait to have any symptoms. However, if you are to have symptoms, then the commonest symptom that most people usually report with is a painless lump. Emphasis on the painless lump. So they may have found something in their breast coincidentally. Maybe they were bathing one day and then they found something hard in their breast, and it tends to be painless. So that's usually one of the commonest signs. Having said that, not all lumps that are found in the breast are breast cancer.
Mm-hmm.
But all lumps, any lump that you find needs to be evaluated properly, so that we know for sure that it's not breast cancer or that it is breast cancer. So when you find a lump, don't panic. Yeah, come in and then let's assess properly, so that we know exactly what we are dealing with. So lumps are quite common. Then we have some nipple discharge. Now, and I keep saying this: women are not allowed to have nipple discharge except they
Mm-hmm.
are breastfeeding. So
Breastfeeding.
that's number one. If you're not breastfeeding, you're not allowed to have nipple discharges. It's not a normal thing, generally speaking. However, some women tend to have some form of nipple discharge at some point in their menstrual cycle. And so you need to know yourself and know if indeed you do have a nipple discharge at some particular point in your menstrual cycle. But if that's the case, and it works for you, it's normal for you, it's not normal for your sister or normal for somebody else, you need to have somebody assess properly. And even even if you claim yours is normal, you still need to get it assessed properly, so that we know for sure that this is related to your cycle, it is peculiar to you. But if you have a discharge at outside this your typical cycle, then you need to be worried and have it evaluated properly. Usually a milky discharge, especially if it's from both breasts, is typically not cancer. But if you're having a discharge from one breast, for instance, or if you have bloody discharge from your nipple, it's concerning. If you have an offensive smelling discharge from your nipple, it's concerning. So you need to have it checked immediately. Then we have something we call dimpling. Dimpling and nipple retraction, they kind of go together. Now, the breast naturally has a contour, like it has
Mm-hmm.
a smooth contour all around it. If at any point in time you notice that that contour is broken, just as you have a dimple in some people's cheeks, if you suddenly notice a depression in your breast, it could be there's a sign that something is pulling the skin inside, and that something could be cancer. You know,
Hmm.
in fact, it's because of this particular symptom, this particular sign. That's why when you are doing a breast examination, whether it's self-exam or you come into the clinic, one of the first things you do is to raise your hand straight up.
Mm.
Because whilst you're raising your hand, if there's anything holding the skin, it will make it prominent, so that it's more obvious. So
Yeah.
when you go in for a breast exam, they will always ask you to lift your hands up straight. So that we'll see what exactly we are doing. And when you are doing a self exam, you do the same thing, so that if that dimpling or if is there, it will be more obvious. Then nipple retraction is similar to the dimpling, but this time it's affecting the nipple. So something is pulling the nipple into the skin, into the breast. You know. Now, naturally, some women have their nipples inverted. So instead of the nipple pointing out, it's sort of pulled in. That's not normal for some women. But they are able to push it out. If you are going to breastfeed, for instance, you cannot breastfeed if your nipple is inverted. So the midwives will usually teach you how to bring it out if you don't know it already. So you bring out the nipple and then you're able to breastfeed successfully. If at any point in time you try to do that and it's not coming out, the nipple is kind of stuck inside. It means that something is holding it
Oh,
inside. So you
yeah.
need you need to try and find out what's going on and have a
Mm.
proper assessment. Then there's size, swelling or shrinkage. Now, this one it will be difficult for me as a doctor to detect, and this is why. every woman has one breast bigger than the other
Bigger than the
breast.
other. Yeah.
It's not just the breast, it's every paired organ. I mean, one ear is bigger than the other ear, one eye is bigger than the other eye, so one breast is also bigger than the other breast. Now, it is your responsibility to know which of your breast is bigger, because sometimes the only sign you will see or you might notice is that suddenly both breasts are the same size, and that shouldn't be the case. And so if both of them are the same size, then it could mean that there's a problem in one of them. So you really need to have it evaluated to know what is going on, so that you
Absolutely.
can deal with it. So these are some of the symptoms. I mean, their symptoms are quite a lot, but these are usually the common ones, and that's come about. I have a visitor
I
who
know.
is I'll tell you afterwards.
The joy of parenthood, huh?
I know. Yeah, so these are some of the symptoms. I mean, the symptoms are so many, but
Mm,
the point is, if you do regular monthly breast examination, which typically we recommend you do it after your period, from 5 days after your period to about 15 days after your period, because at that point the breast is not too heavy, it's not too tender, so that's actually the perfect time to do an examination. And if you do this regularly, you yourself get to know how your breast feel.
mm,
So that if there's a change, if there's the slightest change, you can even pick it much earlier than the doctor can. You see,
yeah,
so it's important that we do the self-examination so that you know how my breast feel at which point in time, and then you can deal with whatever comes out of it. I mean, quickly.
absolutely. So, is it? I'm just trying to ask you a question. Women over the age of 40
Mhm.
are more likely to get breast cancer than women who are lesser or less than 40, isn't it?
All things being equal, yes. The older you are, the higher your risk of developing
Hmm.
breast cancer.
Right.
But you
Okay. So
see, other things come into play, like family history,
yeah,
like lifestyle. All those things come into
yeah.
play. But all things being equal, women above 40 have a higher risk. That is why mammogram is reserved for
Mammogram.
women above
Yeah.
40. Yes, so that's the thing.
Okay. But I know quite a number of women who don't even want to go for mammogram at all. They wouldn't go for screening, let alone go for mammogram, thinking that listen, it's not what I think I need. And then also from our part of the world, which is when I say I don't mean UK, I mean in Ghana, when somebody is diagnosed with breast cancer, could be even in the early stages, instead of them to go seek medical help, they would go around all the prayer centers or the herbal treatment and all that.
Yeah,
And then their final stage is when they get to the doctor and they're told, listen, this is grade 4 or whatever. So we can actually deal with you now, or there's not much we can do. Sometimes the cancer also spreads to other parts of the body.
yeah.
Now, how do we get people to understand that the earlier you come, the more likelihood that your breast will be saved, one, and two, they can detect the cause, what is whatever is happening, and then they can take out the cell or the
Yeah,
cancers,
breast
whatever that is.
cancer.
Yes. Okay. So how do you, as a doctor, how do you get this information out to women?
That's the vicious cycle I was talking about, and it's sort of self-perpetuating, because I mean, once you cut the breast off, it confirms what they be saying. That, I mean, I told you that if you go to cut your breast off, so when somebody else develops it, you know, they ignore the part where they wasted all the time. You see,
Mm,
and then everything is like, if you go to the hospital, and you see, even the herbalists and the religious organizations are also part of the problem, because they'll tell you that if you go to the hospital, cut off your breast. Because one or two people did go to the hospital and they did cut off their breast, it gives them, it emboldens them, and they continue to propagate this misinformation, and it's really a tall order. But you see, now, between social media and women becoming more empowered, we are getting more women coming out and talking
mm,
about their experience with breast cancer. Even those, I mean, I met a couple of women earlier in the month who had actually had mastectomy. Their breast had actually been cut off, but they were talking from a positive point of view, encouraging women to go and get screened early, so that they are using themselves as an
as
example,
an
that
example,
if they are
yeah.
screened early, they would, this may not have been the outcome, you know.
Mm,
But of course, having said that, you might still go in early, and the solution might still be to cut off the breast because there are different kinds of breast cancers. Some of them are more aggressive than others. You see, so it might be that we caught it early, but it's an aggressive cancer which may have spread even before, even at the point that has been caught, it has been diagnosed, and so that's why I keep using May, and because you might still catch it early, but
Mm,
the solution might still be to cut off the breast. But thankfully, and I mean in UK, it's already been happening for a while, and in Ghana, it's now picking up. We are able to still do a reconstruction even when the breast is cut off. And
yeah.
so people have gone through mastectomy and have had their breast reconstructed. In fact, I mean there are some reconstructions that you can't even tell which breast is fake and which breast is real. That's how far
Mm,
advanced the what they call it, the reconstruction
reconstruction.
has come. You see, so even if there's a need to cut off the breast, there's a chance that it can be reconstructed. So by all means, come into the hospital and let's assess properly, and then let us catch it early. It's because there are two cancers that we can actually.
I was going to ask you, are there different kinds of breast cancers? I was just about
Yes,
to ask.
yes, yes.
So yeah,
Yes,
go
there
back.
are there are different kinds of breast cancer. There are different cells in the breast, different
Mm,
cells doing different things. So when we say breast tissue, it's made up of different cells. So any of these different cells can be a source of cancer. And depending on which particular cell it is, it behaves a bit differently. That's why the treatment of breast cancer is not the same. There are different protocols for different cancers. And even in terms of the prognosis, that's why you treat one type of cancer more aggressively than you treat another cancer. So it depends. And that's why when you're diagnosing breast cancer, it's not enough to do examination, it's not enough to do mammogram. They'll still go a step further and take some of the cells. So they will put it, they may stick in a needle and then take some of the cells and actually look at those cells under the microscope so that we know that this is the particular type we are dealing with. And
mm,
so this is the treatment that is available for this type of cancer. You see, sometimes they may actually take a bigger chunk. I mean, so it depends on a whole lot of things, but there are different kinds of breast cancers, but and then I was going to make a point. I was saying that there are two cancers that at this point you can actually either prevent entirely or catch it early enough to make the outcome almost 100%
mm.
um, effective. And these two are cervical cancer and breast cancer. And it's also interesting that these two tend to be either the number one or number two top killers
Yeah.
among the women. So
Mm,
it's quite weird that the two cancers that we can actually do so much about are the ones that are killing majority of the women who develop cancers. It's a problem. We really have to deal with it. And the solution is education, education, education. And as we get more women coming out to share with their compatriots, it's helping carry the message across.
absolutely. Absolutely. Wow. This is hmm. Ladies, let's just go out there and get checked. There's no point in you staying at home and saying my man is going to suck it and press it and knead it and do all that. Go out and get checked. And like Dr. K is saying, all through this month of October, a lot of companies are just even doing it for free. A lot of hospitals are even doing it for free as well. So just go get checked, get screened. If there's nothing wrong with you, hey ho, good. If there's something wrong with you, you get diagnosed early, and then you know that, listen, prevention is always better than cure, like they say. So if we can prevent it from happening, why should we wait until we get to the point where we think, yeah, our breasts are going to be cut off and all that? All right, now, at what stage do you think that mastectomy is imperative?
So I mean, there's a criteria for all of that. So I mean, and the criteria is based on the size of the tumor. It's also based on the degree of spread. It's also based on the type of cancer. So they will do all these assessments and then they will determine, okay, what should we do a mastectomy? The chief reason why we do a mastectomy is because the cancer is in the breast. Now, depending on the size of the cancer is an indirect indicator of how much it can spread. So the bigger the cancer, the higher the likelihood that it can spread or it has spread. And so we want to reduce the cancer load. And to reduce the cancer load means that we need to remove the source of the cancer. You know.
Mm,
So if that source is small, then we can cut a small part of the breast and then remove it because the cancer is small. But if the cancer is big, then you cannot cut that small part. You have to cut the whole breast. So the size of the cancer determines how whether we are going to cut off or not. Then I
Mm-hmm.
mentioned also that the type of cancer, if it's an aggressive cancer, if it's an aggressive cancer, it may have spread even before it was diagnosed. So you want to again reduce the chance of it spreading, so you have to remove the breast. And then if the cancer has already begun to spread, then you don't want to allow any more spread. So that's why you remove the breast again. So I mean, earlier diagnosis is critical. It cannot be overemphasized.
Absolutely, absolutely. Now I know that we you talked about if you have maybe a family history of breast cancer. I've also heard about someone that the grandmother had breast cancer. The mother was diagnosed with breast cancer, and she didn't even want to be diagnosed at all. So she had a mastectomy, double
Yeah.
mastectomy. So she's got both boobs taken off, just so that she doesn't want that to happen to her. So is that going to be is it preventable if you have those if you have a double mastectomy that you won't get it at all, even though
Well, I
it runs
mean,
in your family?
so I think the most popular person who has actually done that is Angelina Jolie. I
Yeah.
mean, she did. There's a gene. There's a particular. We talk about family history and all that. There's actually a gene, a genetic trait that is passed down in families, and you can actually
Mm.
test for this gene. It's the BRCA gene. I think there's one and two. You can actually test for them now.
What did you say? BR what?
BRCA.
BRC.
BRC, yes, or BRCA 1 and 2. So these are genes that you can actually test for. I mean, I'm sure in your jurisdiction it should be easier. In Ghana, you can test, but it's expensive, and I mean they'll have to send the sample outside Ghana. But I mean, if you want to, you can actually get it done. It's just that in Ghana, nobody will probably do an elective mastectomy in Ghana because we haven't finished dealing with the people who actually need the so that's the reality on the ground.
Mm.
But yes, so she did the test and then
Mm-hmm.
it was positive, which means that she had a 75% chance that she was going to develop breast cancer or ovarian cancer or both.
Mm.
So she decided to go and take off her ovaries and take off her breast. And if there's no breast, then there cannot be breast cancer. If there's no ovary, then there cannot be ovarian cancer. So that's the idea behind it. So yes, if you remove the breast, I mean you are 100% protected from developing breast cancer. But you see, that also presents a bit of a challenge, because she has the money and she has the resource and also has the system where she can have proper reconstruction done, because in her case, because it was elective, they're able to preserve significant, I mean, the skin, the nipples. So reconstruction is easy because there was
Yeah.
no problem. There was no problem in the first place. You see, but if you come down to our setting here, where nobody's been ready to do an elective mastectomy, it's a problem to begin with. So what's the point of testing for the gene? It's a conversation that's a bit difficult to have in our
Mm.
limited resource setting. But
Wow.
it's possible to get tested, and then if you're able to remove your breast, then the risk is 100% removed.
Wow. Okay. I mean, I think that um a lot of women are scared of getting a mastectomy because they think that it deforms them. And a lot of women actually take pride in the boobs they carry because, it makes them feminine. So taking it off, it makes them feel a bit empty, a bit bare. But like you're saying, education is important. So once they've been educated, like they say, whether you have it or not, it can either be reconstructed. If it's not reconstructed, it doesn't actually change who you are because people are actually using that to tell a story, to educate you, to let you know that even though you might not have boobs, you're still a woman. Now, like I said earlier, today I heard a word, and that is called secondary breast cancer. Now, what is secondary breast cancer?
Well, so I mean, it's really not a new term per se,
Hmm.
and
No,
really,
to you, it's not a new word. To me, I thought breast cancer was just breast cancer. If you've had it, you've had it. But now, being diagnosed with a secondary breast cancer, I thought, wow, what is that?
so really, it's not even related to the breast per se. I mean, it's breast cancer that has spread, what's it called, beyond the breast. So let's say it has spread into the liver, it has spread into maybe the lungs, it has gone into the brain or somewhere in the bone, then they would say secondary breast cancer. But we really don't even use that terminology. We use metastasized,
Okay.
so that it's pretty much, so I guess it's the same thing. So secondary breast cancer would be same as saying the cancer has metastasized, to the liver or to the brain or wherever. So and that's the thing about cancer. You see, it can break off and go and implant elsewhere. And so
Hmm.
let's say your the let's take the brain. The brain is sitting in the head, in the skull. The skull is bone. There's no space. It's a limited space. Now,
Hmm.
if breast cancer cell enters the brain, it continues to divide. It continues to get bigger, but the skull cannot get any bigger. So what's going to
Hmm.
happen is that it's going to exert pressure on the brain. So then people, if cancer spreads to the brain, that person might start developing things like convulsion because there's pressure in the brain.
Hmm.
It can start developing problems with vision because there's probably compression on the optic nerves. So that's why we don't want cancer to spread. But when it spreads, it takes over whatever space is available and causes problems for the person. If it spreads to the bone marrow is where the red blood cells are produced. If breast cancer cells spread into the bone, it's going to take over the bone marrow. So then you're not going to be able to produce red blood cells. So then you begin to have anemia, and then
Hmm.
you probably get heart failure as a result of the anemia, and then you die from the heart failure. So we don't want cancer to spread. I think that's the summary. As much as we want to catch it early so that we can remove the source of the cancer and then deal with the rest of the thing with chemotherapy, radiation, or immunotherapy or any other therapy that's available.
Well, I was going to ask you that, but I think you've already brought it. So let's go straight into that. Now, you mentioned chemotherapy, you mentioned radiotherapy, and what was the third one you just mentioned?
Immunotherapy.
What? Sorry, say it again.
Immunotherapy.
Immunotherapy. All right. So, what are the differences in all these three?
Okay, so well, I mean, chemotherapy refers to chemicals or drugs. You are trying to kill the cells. The cancer cells are quite fast dividing, so it's easy to target them. If there are medications that target fast dividing cells, of which cancer cell is one. The only problem is that the body also naturally has cells that divide fast, naturally dividing fast. They are not cancer cells, but they are fast dividing. But the chemotherapy is not able to distinguish between the cancer cell and the normal fast dividing cell. So that is why the chemotherapy usually comes with side effects such as loss of hair, because hair cells divide quite fast. The mucous membrane, so the oral cavity, the stomach lining, they also divide fast. So that's why when a chemotherapy, they come in with bleeding gowns because it's being attacked as well. Then the nails also they divide quite fast. So one of the side effects of chemotherapy is that the nails will become dark, sometimes black. They may even fall off. So these are some of the side effects of chemotherapy. Then there's radiotherapy, radiation therapy. I mean, where you are going to target radiation to burn the cancer cells.
Hmm.
So that's also available. Of course, that also has its own side effects. But the idea is that it's targeted, so it goes directly to where you point it, where you want it to go and kill the cancer cells, and so it goes there, and that's just that. Then we have the immunotherapy. You see, ultimately, your immune system is also part of. I mean, it also plays a major role in fighting and in trying to destroy the cancer cells. So immunotherapy empowers the immune system and gives it extra ammunition to go and fight the cancer cells. There's even a fourth therapy, that's the hormonal treatment. I mentioned that estrogen is a major player in the
Yeah.
breast cancer. And so there's treatment targeted at blocking estrogen, so that if there's no estrogen there, the cancer cell will naturally begin to regress, or they begin to involute, because the estrogen that was stimulating them is no longer there. So some of the treatment of breast cancer also targets prevent or block estrogen from having access to the breast. So these are the broad treatment modalities. But generally speaking, breast cancer treatment does not follow any single what they call you don't only treat breast cancer with one what is the word? The English is finished. With one therapy. Yes, it's usually a combination therapy. So you have the surgery, then you have the chemotherapy, you have the radiation therapy. So typically you start with chemo. because the chemo to sort of shrink the tumor, make it smaller for easy for to make the operation easier, and also to reduce the risk of spread. Because when you're going to do the surgery, you might be handling the tissue and it might actually encourage spread. So you want to reduce that risk by giving chemotherapy before the surgery. Then you go through the surgery and then you continue with the chemotherapy after the surgery to mop up any cancer cell that may have been left behind. Then you, along the same line, you do radiation to the site to make sure that if there was any cancer cell left behind,
It's
you
killed.
radiate it. Exactly.
Mm.
So every cancer treatment is it might have a higher component of chemotherapy and a lower component of the others, or it might have a high component of the others. It all depends on what they find when they do the analysis under the microscope. So some cancer cells, or some types of breast cancer might not even respond to hormonal therapy, so there's no point giving hormonal therapy. Some of them might not respond to immunotherapy, so there's no point wasting money on immunotherapy. So based on what information you get from the pathologist, then it will guide it will inform your decision as to what treatment to focus on for this particular person. So from diagnosis to treatment, it can take up to about a month, depending on availability of resources, before treatment will begin. So it's not an immediate thing. It's not as if when you diagnose today, then you start treatment tomorrow. It takes some time.
Wow. This is very, 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 very informative, and I think we all need that. So, as a woman, is there anything we can do to block these estrogen hormones in us?
Do you really want to block estrogen?
Well, if it's, I mean, as a preventive measure, is
Well, I mean, here's the thing. Fat is able to convert fat will increase your estrogen, the estrogen in your blood in a way.
mm,
It converts other proteins into estrogen. This is why obesity is actually not good. So if every woman is able to maintain an ideal weight for their height, that's your BMI,
mm-hmm.
it will help reduce your risk. You see, so that's definitely one thing we can do to reduce our exposure to estrogen, because the more overweight you are, the higher your exposure to estrogen. So we really need to try and get our weight in check to help us.
Maybe we all need to start going to get this fat drawn out of our systems, so we don't
You
have any
know,
fat at all.
no, but you still need fat to do some things. But I mean, that's why the BMI is a good guide.
Mm,
The BMI is a ratio of your weight to your height.
your height,
And
yeah.
there's a range. So I mean, there's a range. So you're allowed to have a certain amount of weight and an amount of fat, which is good for you. But when you go over it, then you begin to put yourself at risk. And the more over you go, then the higher the risk you're putting on yourself.
Lord help us. We all need to now come on, get on the treadmill, get on some good diets, and lose some fats in our systems to make sure we're all healthy. Now, when we were talking earlier, we talked about screening and we talked about mammogram. For
Yes.
somebody who doesn't know what these things are, what is screening and what is a mammogram, please?
So the mammogram is a kind of screening. So generally, this is the trend. So you are supposed to do your self-examination at least once every month. Then once a year, you need to go in for a formal breast exam by a professional, so that they can either confirm that what you are doing has been right or not
Mm-hmm.
right. Then if you're under 40, this is usually okay. It's enough. I mean, when doing the self examination, doing the clinical exam with the specialist or with the doctor, that is usually enough for those under 40. But if you have a high risk, as in you yourself, you are probably overweight, and you have never given birth, your mother had breast cancer, or you yourself have had breast cancer before, then you are not going to wait until 40 years before you start doing mammogram. You start doing it earlier. So you have to have that discussion with your healthcare provider, and then decide when you should start. But if you don't have any of these risks, then when you have 40 years and above, then after you have done the clinical examination, the next step is to do the mammogram. You know. Now we don't like to do mammogram for under 30 and under 40s, because the under 40 breast is dense. It has significant breast tissue, and breast tissue is absorbent of radiation. So we want to limit the amount of radiation, because mammogram is actually it's an X-ray.
X-ray, yeah.
Yes. So we want to limit the exposure to X-ray as much as possible, because if the breast tissue is going to be absorbent, then you're going to be exposed to X-ray. Then it presents a challenge because radiation can also lead to cancer. So we want to limit it as much as possible. So if you're under 40 with little or no, I mean average or little risk, then we are not going to put the cost is more than the benefit. So we are not going to
Mm.
encourage you to do mammogram. you know. But if you're above 40, because now the risk of developing cancer is literally galloping,
Yeah.
now the cost is the benefit of doing the mammo is now higher than the cost of radiation exposure. So now we can do the mammogram, but even then we're not going to be doing it every two months. We're going to do it once every 2 years. Some people even do once every 3 years. So if you do it this year and it's normal, you continue with your self-examination and your annual medical checkup, and then you repeat the mammogram after 3 years, after 2 to 3 years, so that if there's any change, it is picked up early. So that's what needs to be done. And if every woman can have this done, I mean, it would
Mm.
it would it would it would save us a wealth of pain and suffering.
Absolutely. No, I really do think so. I really do think so. Oh, I think have I lost you, Dr. Kevin? I think I have. Oh dear, 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 dear. Just when it was getting interesting, I lost him. Oh no. Anyway, guys, listen. We've all heard a lot. If you've just joined us, please go and watch the replay so you can get all the information Dr. K shared from the beginning. Okay, it's important that you get information is absolutely important, and especially, oh, is he back? Dr. K, are
Yes,
you
I'm
back?
I'm, I'm back, but ECG has done their thing. So let's leave it there for.
Oh dear. Oh no. Okay, no worries. That's fine. As long as we can hear you, that's okay.
Yeah.
That yeah, and actually we're nearly wrapping up, so no worries at all. I was saying that what you've shared so far is very informative, and I want everybody to. I mean, if you haven't watched it, or if you would listen to us later, just go and watch the replay and get all the information that you need, because it is absolutely necessary that you grab this. Knowledge is power. Listen, it's important that you get all these things, get to know what your estrogens are. Do you even know what estrogen is? You might not even have a clue about what estrogen is. Okay, so guys, just go back and just watch the replay, because we're just about wrapping up. And as you can see, Dr. K's screen is actually gone black because what is it, ECG they call them? Electricity Company of Ghana doesn't want him to continue. So I was just about to go asking him the final question when this happened, because I heard about triple negative breast cancer and I wanted to know what that is. But hey, I've lost. Oh, are you there, Dr.
So
K?
yes, I'm here. I'm here. So the triple
Okay.
negative. I mean, I actually touched on it earlier, but I didn't use the technical term. So I mentioned that when you send the sample to the pathologist, they are going to be checking for does the cancer respond to what they call it, immunotherapy? Does it
Yeah.
respond to hormonal therapy? So if it responds to immunotherapy, then it's a positive. But then if it doesn't, it's a negative. So if it doesn't respond to hormonal therapy, that's also another negative. And then there's
Mm.
another index that they will check again. So that's what triple negative means. So triple negative is it usually tends to be an aggressive tumor that's a bit difficult to treat. So this is one of the cancers that, regardless of the size, they probably do a mastectomy, because I mean, if you don't do that,
It
it's going
doesn't
to spread.
respond to anything. Mm.
Exactly.
Wow. This is terrible. So I think that, like we always say, prevention is better than cure. So once you go get tested, make sure that you are well. You go for your screening to check, you do your self examination. If you're over 40, go and get mammogram done, and then you repeat it every other year. So, like every 2 years. So, every other year, you go get a mammogram done. It's important that we spread the word. As women, we spread the word that, listen, screening doesn't mean that you're going to expose yourself to a man or anything. If you, like Mr. Kevin said, if you don't want a male to do the assessment, you can get a female nurse or a female clinician to do it for you. So please, let's spread the word. Breast cancer is still killing women, it's still destroying families, it's still hurting homes. Prevention is better than cure. In as much as you can get cured with early detection, it's also important that you get the necessary treatment. When you go and they tell you, oh, we've seen a lump and we're taking it to the lab and we think that it's cancerous and all that, don't get scared. Prayer is good, but so is medical intervention. Don't just go and say, I'm just going to pray, I'm going to do herbal treatment, and then you leave yourself to chance. And then in the final hour, when you think this is it, you can't do it anymore, that is when you go to the hospital because you think that as long as it's breast cancer, you need to have a mastectomy. No, you won't necessarily have a mastectomy depending on the treatment that you get. Dr. Kevin, I'm going to love you and leave you because I think they don't want you to come back on again. But hey, it's been amazing. And I'm sure we're going to catch up again soon because we need to do a session as well on cervical cancer very soon. And so, Dr. Kevin, if you can hear me, have a lovely evening. I will leave you to sort your family out because it's very dark. Um,
Yeah.
yeah, and then I will
Thank you very
catch you
much. Thank
on
you very
the
much
other
for the
side.
opportunity.
Thank you, thank you, thank you, thank you for coming on. Thank you so much. Thank you. Right, guys. So that was me and Dr. Kevin having a conversation this evening about breast cancer. We said all about breast cancer. So we talked about the causes, the treatment, intervention, the aftercare, and beyond. Listen, get treatment, go for screening, get mammograms done, and take care of your health. Like he said, your BMI is important. So check what you eat, check your weight, make sure you're exercising, you're eating healthy, and just put yourself there. Listen, life is good, but you need to take care of yourself to enjoy life. Take care of yourself to enjoy good health. Don't I know sometimes it's difficult for us to even get out of bed and go for a walk. But hey, do it. Your health is your wealth. Okay. So please go get checked. It's usually free through the month of October when we do the breast cancer awareness month. So breast cancer screening is now free in most companies, I think corporately and medical centers, clinics, and I even heard some churches are doing it as well. So go get checked. If there's any problem, early detection is always the key to survival. And don't say that, well, my husband is going to press it. My my husband is going to press it. My husband is going to suck it tonight, and so I can't get breast cancer, guys. That is all a myth. All right, whether your husband presses it or doesn't or whatever, it's all a myth. Go get checked. Okay, your life is important. You are valuable. You're priceless. You are the mama of the house. You are the sunshine in the house as a mama, as a woman. Okay, so don't let breast cancer take you away from your family if something can be done about it early. Right, you all have a lovely evening. Enjoy the rest of your week. And I will see you again very soon on Saturday morning. I'm on your screens again with Coffee on the Couch, and you don't want to miss it, where we talk about everything to do with relationships. And we're still talking marriage maintenance on Saturday morning. So grab your coffees with me on Saturday morning. Let's sit down and have a chat and have a good laugh and enjoy the weekend. The Lord bless you and keep you. The Lord make his face shine upon you and be gracious unto you. Go through this week with the confidence and assurance that greater is he that is in you than he that is in the world. The Lord loves you and so do I. Please go for screening. Go get checked. Early detection is always key to survival. The Lord loves you and so do I. Enjoy the rest of your evening until I come your way again next time. I'm your host, Sandra G. Bye bye.